Hi, my name is Alice Hart-Davis, and this week's Tweak of the Week is Ultracel, and I'm wearing my Knightsbridge shades because I'm just opposite Harrods at the clinic of Dr Rita Rakus, who is going to be showing us the Ultracel treatment. This is a high-intensity focused ultrasound treatment for tightening and lifting the skin on the face. So come along in and see how it goes. Dr Rita, Ultracel, this is an ultrasound treatment for lifting and tightening the skin, isn't it?
It is. It tightens the collagen, lifts the skin. It also stimulates new collagen growth. Now the Ultracel machine actually has three components. It's got the ultrasound component, the radiofrequency component, and then the microneedling component.
Oh yes.
Now historically we had thermage, which was radiofrequency. Then we had therapy, which was ultrasound. So this machine, we can deliver all three, which is quite exciting. It lasts approximately 3 years. But the most exciting part about it is it doesn't hurt. Because the older machines...
ultrasound, it has a reputation for being a bit
and a little bit of swelling, bruising, very rarely a bit of nerve damage. But this one, it doesn't hurt at all. You don't have any bruising, you don't have any swelling. And in a way, I say to my patients, the older machines are like iPhone 2s or 3s. This is like an iPhone 10, so it's the newer technology. But just because it doesn't hurt doesn't mean you don't get amazing results.
Fantastic. Right, we'll go and meet Karen, who's going to be your patient.
Wonderful.
And then we'll go on to the treatment.
So what we'd like to do, I presume this is what you like, if I just, excuse me, touching your face, if you have a look in the mirror. There we are, so we're going to give you a little bit of a tighten up here, tightening up under the eyes, lift you up here, let's sort in a cabinet. Excellent, so this machine doesn't hurt, and what we're going to do is we're going to lie you down, put some gel on you, and away we go. We're going to pop a little bit of gel on for you. We do one side of the face first, and hardly feel this. Some areas tweak a bit if we're close to brow. Have you got any fillings?
Only one.
Yes, that may tweak a bit, but generally it's fairly painless.
And ultrasound works on the muscle layer under the skin,
Well,
doesn't it?
it's actually sort of, what they call it is the SMAS layer where the plastic surgeons work. It doesn't theoretically affect the muscle. It treats collagen. So I'm going to start now and just see how you're going on this. You okay?
Yeah.
So it tightens the collagen. As you get older, your collagen is like an old elastic band. So it shocks the collagen into coiling up again into a nice tight elastic band. And then it also stimulates new collagen growth. So it's good like that. So of course, although it doesn't treat muscle per se, but everything is enveloped in collagen. For example, little baskets of fat have got collagen around them. The muscle, the tendons have got collagen. So anywhere where there's collagen, it'll get tightened.
Karen, how's that feeling?
It's fine. It's like little stings, I suppose, every now and then.
But on a tolerability scale?
Sort of a 3 or 4.
So pain-wise, 3
Yes.
out of 10?
Yes.
So that's like nothing?
It's not much.
Not like almost nothing.
So basically we just do this. We do quite a few hundred shots and we just repeat ourselves over and over again. Now it tightens the collagen, gives it a shock, and the collagen goes slowly over a period of 3 months. It gets its coil back.
Okay, so initially after the treatment you'll see a very slight
about
lift
10%.
at first, and then you get the full result
3
months later.
And then we as a clinic in particular do a free top up at 3 months.
Oh, that's nice.
And then and even at 6 months if you need a bit more.
Okay. And how much does this cost?
This, if you have, it can start from 2,000, but it can go up to 4,500 depending on how much work we have to do and how much of the face we do.
And does it suit some people more than others?
Well, if you've got too much of a drop, we can still give a lift, but if you're more in facelift territory, whereas it's good to have it done at your age because it's nice and preventive and you don't have much wrong with you.
Yeah.
So it's quite good.
And one thing people worry about with ultrasound is that it's going to somehow melt the fat under the skin. Is that a problem with this machine?
Not with this machine. There have been reports with the old therapy, but this is more modern technology, so there's no reports of fat melting.
Okay, so you're going to keep all the fat you can hang on to in your face.
Exactly. And also there's a lot in technique, because one of the mistakes is that if you do a lot, say, in the cheek here, it will tighten. So if I were to do most of my treatments here, it looks as if this has gone hollow because it's all tightening here. So I need to do the vectors, you see, rather than do most of the shots here.
Yeah.
Because although you have a melted fat, if it tightens, then it looks as if, you see. Whereas if I pull up, it gives you actually a better look. And I've done 20,000 of treatments now with these machines, so we've had quite a bit of experience.
20,000, so you know what you're doing.
Exactly.
Yeah. Well, it's good to see it in action. How was that?
It was absolutely fine.
I mean, it looked very easy, very, very tolerable. Just the odd.
And there was the odd bit where it just felt like little stings, really.
Yeah.
When she was near the bone, it did hurt a bit more.
Yeah.
But because it only lasts for a microsecond, it's bearable.
Okay. And you look pretty much as you did beforehand. I mean,
I'm sure.
We weren't expecting a big result of that, but like Dr. Rita was saying, there'll be like 10% of the change will come now. But I mean, your face, I don't see any sagging in there to lift. It's in fantastic shape. But the result will come through in 3 months' time once that collagen. Yeah, we'll keep an eye on it.
Forward to it.
Yeah. Okay. Well, thanks for being the guinea pig for us today.
Pleasure.